On April 10, 2012, Indiana Hospital Association launched a hospital engagement network, Coalition for Care, through the American Hospital Association's Health Research and Educational Trust, supported by the Centers for Medicare and Medicaid Services Partnership for Patients Initiative. IHA and its participating member hospitals are joined by 33 other state hospital association partners and more than 1,600 hospitals throughout the country working to reduce patient harm by 40% and readmissions by 20% by the end of 2013. No easy task. IHA's 119 Hospital Engagement Network participants have been working diligently to achieve the Partnership for Patient Safety goals while improving overall patient safety and quality of care. Indianapolis-based Franciscan St. Health is a Coalition for Care member, focusing on all 10 Partnership for Patient target areas for improvement. This accountable care organization has actually tied the Partnership for Patients goals into its own journey to excellence and has seen measurable improvements in patient and employee satisfaction, patient safety, and the quality of patient care.
We have 5 Franciscan values, and those 5 Franciscan values are extremely important to us. Respect for life, compassionate concern, joyful service, fidelity to our mission, and stewardship. And they're taken strictly from the life of Francis. That's our DNA. In other words, as Francis lived his life, as Francis ministered to the sick and the poor and the indigent, so too all of our employees know that we're one family. And being one family, we hold one another accountable.
In 2008, we were looking at the organizational goals and the strategic plans. And as we all know, strategic plans can become very lengthy, 50 pages plus, depending on how much you want to put in there. So we decided that it was going to be a really nice thing if we could engage our staff from the top, from the CEO, all the way down to our frontline staff, and be able to develop goals that we all knew what they were and we were all working in the same direction. And that program was the Journey to Excellence.
Driving performance at St. Francis has always been a partnership between our board of directors, our senior leadership, our clinicians, and our physicians. We bring all of those people together in the Quality Council to help establish goals and to drive performance and to help us set priorities. 6 years ago, 20% of our staff left every year. Today, 10% of our staff leave every year. Quint Studer tells us that organizations who have an 88% retention rate or higher are safer hospitals. This year, we were recognized as one of the safest hospitals in the country by HealthGrade. Our patient satisfaction is higher because when you're doing the right thing and you're taking good care of the patients and your employees are happy, your patients will be happier.
I believe that the employees here at Franciscan St. Francis Health have a longevity in their service because they're actually called to the ministry of the philosophy of the Sisters of St. Francis. The individuals who work here come with a heart that is mission-driven and wants to follow the mission and values of our organization. And I believe that they find that they are really being able to be involved in patient care, impact patient care, and make a difference in people's lives.
One of the Journey to Excellence goals set forth by hospital leadership was to make sure that our infection rates are low and that our patients are safe, they're protected from getting infections while in the hospital. I think that protecting our patients from infection in the hospital matches the mission of the hospital and what every nurse wants to make sure they do when they walk into work every day. They're here to protect their patients and to take care of their patients the best that they can.
I believe we are constantly improving care, but that we have really reached an enhanced level of nursing practice here at St. Francis. We have challenged our nursing staff to acquire a professional practice model, and that means that nurses are held accountable for the quality of their care. We've spent a lot of time using metrics and using Lean Six Sigma techniques in order to do performance improvement. We've spent a lot of time educating the staff about how we do performance improvement and how that's really aligned with our mission and values.
Pressure ulcers are one of those hospital-acquired conditions that has been directly linked to the amount and the quality of nursing care that is provided. In 2008, moving into 2009, we really began ramping up our internal processes for measuring and tracking and preventing hospital-acquired pressure ulcers to meet those CMS requirements and to protect our patients from harm during their stay.
We always are looking for better ways to improve our rates. We were down to 0.5 in incidence, and to Stephanie and I, that's still too high. Even though the national average is 3.3, we want to get it down to 0. No patient should have any kind of pressure ulcers while they're in our hospitals.
Franciscan St. Francis Health attributes reductions in hospital-acquired conditions and patient readmissions to the implementation of programs and techniques focused on efficiency and quality.
We implement Lean Six Sigma throughout our organization. We've applied it a lot recently in patient satisfaction. We've seen some significant improvements in patient satisfaction, whereas we had seen growth and improvement over the years, but with the application of some of the methodology, we were able to see larger improvements in areas where we were able to reduce wait times, improve throughput, and meet our customers' expectations.
We initiated what we call the Passport program that ties right into our Journey of Excellence program. And what we do with those is the goals are, once they're decided upon, they're printed into a formal small document. And because this is a journey, we're looking at passports that we're all traveling and making this journey. And this all goes to the frontline staff. Every employee receives one of those. And then with their managers and their supervisors, they work on how can they be part of that.
I think one of the most important things that we've implemented is introducing Kaizen. And Kaizen is a Japanese word meaning change for the good or better. And part of our journey has been to get that, get Kaizen applied at every level of the organization, engaging every employee in small continuous changes throughout the work that they do.
We've made tremendous progress in the area of medication safety, which from a physician standpoint is obviously a huge issue. And I think we're well down the road in terms of our medication reconciliation, which basically means, we make sure that at every step of the patient's care they're getting the right medications, right doses, and they understand when they go home what their medications are.
Our culture has always been to include our practitioners and engage our patients in their care. That is a key focus that we have in our population. Readmissions within 30 days is sometimes common if the patient is not appropriately contacted following discharge. So we are going into the home to educate them around their medications and other things such as dietary and exercise regimens that they need to utilize to keep their health better and keep them out of the hospital.
Our journey has got to be, I think, the same as all hospitals' journey to excellence. We need to do our part to reduce costs while we're improving quality and improving the health of our population.
We partnered with the Indiana Hospital Association, and they have partnered with and contracted with HRET, the Health Research and Education Trust, under the American Hospital Association. And we have been thrilled. We may have the largest hospital engagement network in the country. That is so much knowledge and so much information that we have at our fingertips and access to any given time of the day. And the educational opportunities are just phenomenal.
Franciscan St. Francis Health's journey to excellence is far from over, but the organization has shown us that through hard work, dedication, and input from all levels, that anything is possible, and that reducing inpatient harm by 40% and readmissions by 20% in all 10 targeted areas by the end of 2013 are achievable goals.